Sex. What comes to mind when you hear the word sex? Am I allowed to say sex? Yes. Is oral sex considered sex? Yes. Can I get pregnant? Yes. Can I catch an STI? Yes. Why is it that pregnancy and STIs always come up last, or sometimes never at all? Maybe this will make you change your mind. Did you know that over 75% of Canadians will get one STI in their lifetime? Did you know that 85% of women who have sex without a method of birth control will get pregnant within 1 year? You may be at a point in your life where you're starting to think about your sexuality, and that's okay. This is a normal, natural human process for girls and boys. However, if you're going to be sexually active, or you already are, it's important to be well informed. Talk to a healthcare professional to discuss things like birth control and preventing sexually transmitted infections, or STIs for short. Hormonal contraception, like the pill, the patch, the ring, the shot, is the most effective way to prevent an unplanned pregnancy, but there are other good choices as well. Condoms are the only way to protect men and women against sexually transmitted infections, and they also prevent pregnancy.
Hi, Jennifer.
Hi.
Hi. My name's Doug Black. How are you?
Okay.
Nice to meet you. So, Jennifer, I see you here today because you'd like to find a method of birth control.
Yeah, I really don't want to get pregnant at this point in my life.
Okay, so if remembering to take a pill every day is something that you think you'd be able to do,
Yeah.
perhaps the oral contraceptive pill might work for you.
Okay.
Otherwise, there are other methods of contraception that don't have to be taken as often. For instance, there's the patch. It's worn for 1 week, and then on the 7th day, you replace it with a new patch. You're patch-free on your 4th week. Next, we can offer you the vaginal ring. This is inserted into the vagina and stays there for 3 weeks, releasing hormones. The ring is removed on the 4th week, and then your period comes. There's also the option of having an injectable contraceptive, and that's given every 3 months. Then there's the intrauterine device or intrauterine system, and this is a little T-shaped device that's inserted into the vagina and then into the uterus by a healthcare professional, and it can sit inside the woman's uterus for up to 5 years. You should also give some serious thought, however, to using a dual method of contraception. That is, your partner will use a condom while you use a hormonal method of contraception. The reason for that is it protects you both against a pregnancy, but also against developing a sexually transmitted infection.
Wow, there's a lot more to this than I thought.
Before we discuss your choice of birth control method, I need to ask you about your medical history and to do some tests. Have you ever tested for sexually transmitted infections or had a pap smear?
No, I'm new to both.
Since you've been sexually active before, Jennifer, I recommend that we do a pap test and a pelvic exam today. We will also test you for sexually transmitted infections.
During a birth control visit or STI test, a health professional may ask you some questions about your sexual experiences. This gives you and your doctor more information to talk about what's right for your lifestyle and medical history. It is normal for these questions to be asked. Are you sexually active right now, or have you been sexually active in the past? This includes oral, vaginal, and anal sex. Do you have sex with men, women, or both? Have you experienced any noticeable symptoms of sexually transmitted infections, such as sores on the genitals, a burning sensation when you pee, or any unusual discharge from the genitals? Have you or any of your partners used injection drugs? When was your last period? When was your last pap test? When was your last STI screening?
Thanks for answering these questions. Some of them are pretty personal, but it helps you and I decide what option is right for you.
So what are the most common infections in people my age?
Well, the most common sexually transmitted infection is HPV. That is the human papillomavirus. Genital warts are the only visible symptom, but most times you never know you even have it. But with a pap test, a doctor or a nurse can check the cells on a woman's cervix and see if there are any abnormal changes that are caused by cancerous types of HPV. There's also a vaccination now that can protect you from HPV, and we'll talk about that later. Genital herpes is another common STI that can cause blistering sores, but often has no symptoms at all. We also see chlamydia in many young women, which can be easily cured with antibiotics. but very often there are no symptoms of chlamydia. And if there are no symptoms, it may be left untreated, which can cause infertility. Sexually transmitted infections are tricky because individuals can display no symptoms for weeks, months, or even years after the infection. They're hard to spot, so you could get one and never know. That's why using condoms consistently and with each sexual partner helps to prevent catching and spreading of STIs.
Well, I have a boyfriend, but he says that he doesn't like to use condoms.
The decision not to use condoms is your decision too. If both of you decide not to use condoms, it's a good idea for your boyfriend to make an appointment to get tested for sexually transmitted infections first. And remember, even if the two of you test negative for STIs, you'll both be protected only if you stay monogamous. That is, no sex with anyone else except each other. And if either of you do end up doing something that you didn't plan to do, use a condom. Should we move on to the STI test now?
Sure, that'd be fine.
So what brings you in here today, Jimmy?
Well, I'm in sort of a relationship, and my girlfriend's going to start taking the pill or something, and we'd rather not rely on condoms, so we wanted to get checked to make sure we don't have anything going on that we don't know about, like no STIs or whatever.
Okay, I see. So you've both been sexually active in the past?
Yes, sir. We both were in relationships before we met, and we both had sex before. I've always used condoms, but I'm not a big fan.
All right. Well, the way this works is that we start with a visual examination. Have you had any burning when you pee or a discharge from the penis or seen anything unusual like bumps or sores?
No.
Sometimes STIs don't have visible symptoms, so I'll need a sample. In the old days, they would put a swab in the penis to take a culture, which can be a little uncomfortable. But today, most places use a urine sample. You'll need to provide a urine sample to check for infections. If your last pee was 2 hours ago or more, we can do it right now. If not, then I'll give you a bottle, and tomorrow morning just fill it up and drop it off at the lab downstairs. Depending on the types of sexual activities a person's been involved in, swabs can be taken from other parts of the body that may have come into contact with infection. For women, a vaginal swab is used to test for infections, especially if there's an unusual discharge or visible sores in the genital area. This procedure may also be done during the Pap test. A person who's been on the receiving end of unprotected anal sex might require an anal swab. Some STIs can be transferred from one person to another through oral sex. When that's a concern, a swab may also be taken from the back of the throat. And lastly, a simple blood test can be used to detect some STIs such as HIV, hepatitis, and syphilis. All right, Jimmy, you're all done. Your results should arrive in about 3 weeks. We'll call you only if there's something you need to know. No news is good news. So the way this works is, once you decide what method of contraception you want to use, I'm going to write you a prescription, and then you're going to go to the pharmacy and pick it up. I'll first of all give you 3 months as a trial, and then you'll come back and see me, tell me how things are going, and then if everything is working out okay, I'll write you a prescription for the rest of the year, and you can be on your way. For the injection, or the IUD or the IUS, things work a little differently. If we decide on any of these methods, we'll have to make another appointment. Here's a great tool that can help you understand about these pros and cons of each method. Now, let's choose a contraception method that's right for you.
For more resources, information, and videos about sexually transmitted infections, contraception, Pap test, and pelvic exams, visit sexualityandyou.ca or check out our YouTube channel, youtube.com/sexandyou.